Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. I'm here today to discuss a topic that's very dear to my heart. I know I say that a lot, but I mean it. And today we'll be talking about chronic care management. What does that mean? Why should I care? Why are we having this conversation? If you're watching live, hashtag live. If you're watching replay, hashtag replay. And for those of you who are wondering why this topic, I'm having this conversation because one of the things I have found out as a primary care physician is that sometimes the burden of care is still on my heart, even after the patient has left the clinic, right? So it then became a question of what can I do in between visits to make sure my clients, my patients are well taken care of? And that's why this topic came about. So with chronic care management, these are some of the ways or extensions of the practice, Living Spring Family Medical Center, where patients are kept an eye on and attention is called back to us as needed. For example, you have a patient, high blood pressure, lives alone, little elderly, hard to come in. Well, can only come see me maybe once every 3 months. Well, in between visits, I can have someone, checking on the patient, make sure vitals are good, make sure other things are good in between those times. So by the time the patient come back, they're not worse off than when they saw me, or they have not deteriorated. Okay. So that's why having this conversation. So if you know someone who could use this, please tag them, forward this video to them. I'm going to bring up our guest, and then I'll introduce her. All right. Martina, could you hear me the whole time? I don't even know
Yes,
if you
I
can hear me.
can. Yes, I can.
Good. Okay, good. All right. So do me a favor, kindly introduce yourself, who you are, what you do, and then we'll go from there.
Yep. Hello, everybody. I am Martina Janeckova. I'm the CEO of Lara Health. Lara Health is a software and service platform supporting wonderful doctors such as Dr. O and her patients by offering them a platform, all-in-one platform, so these practices can offer this type of a support Dr. O explained to patients with chronic conditions in between visits. So we are the software and the service partner of primary care providers and Dr. O looking and helping her to look after her patients.
Awesome. I like what you do. Yay. But real curious, why do you do what you do? What got you into this?
Well, funny you ask. I actually did not start in healthcare at all. It was, I'll say, a happy coincidence. I started in finance in Wall Street, and it was a very different type of a job I did, a very glamorous job. I also found it very soulless and purposeless job. When I had a family, I decided I don't want to be in finance. There was a lot of travel involved. And by a complete coincidence, I joined a startup probably more than a decade ago. And Dr. O, you might remember, there was a time where everybody was obsessed with Fitbit and counting steps and looking at smartphone and hitting the goal. Well, I worked for a company that was like a Fitbit for healthcare. They manufactures and sold devices for patients with high blood pressure, diabetes, heart issues, to monitor their health and keep a track of it. And we empowered these patients with the data so they could learn more about their health. And I found that fascinating because that type of a job had a purpose. And so my job was create engagement for these patients and really find a value in using the devices, using them often, and learning from the data. And so over time, we've built these wonderful engagement programs. And what we learned is it's not only kept our users interested in measuring the blood pressure, looking at the variations of the data during the day, during the week. We also saw they started sharing it with doctors, and doctors found that very interesting as well. But what was the most fascinating part was I realized that when we started making little suggestions, just small tweaks to the lifestyle, patients started seeing improvements in their health. And that was really an eye-opening experience to me because I realized that if you live with the chronic conditions, small, tiny changes make a huge difference over time. And it really empowered the patients, and the data empowered the doctors. And so 4.5 years ago, I decided I really wanted to build something powerful, something that would empower the doctors equally the same way as, the previous company empowered the patients. And that's how Lara Health was born.
Awesome. I like the name, Lara Health. Why Lara Health? Let me ask, why Lara?
The company I work for had a very funny name, and it created always a confusion. Whatever we call, they thought we had calling from hospital or, a specialist department. So I wanted to have a very simple name, very simple company's name that everybody can spell out very easily. And it's a long, it's a very short domain name if somebody's looking for us on the internet. But I also wanted to have a female name, because once somebody told me the reason why every ship had a female name, and it was because sailors were men. And they would travel the world. And, hundreds and hundreds of years ago, it was a very dangerous job to be a sailor. And so each ship had a female name because it empowered the men, and it made them think of the wives and the mothers, and they felt protected and cared for. And I very much like that. So I wanted to have a female name for a company that hopefully is doing a good job, protecting and empowering our patients and our doctors.
I have to say, my patients like it. They like the check-ins. My patients who are a little more independent and they're like, I don't need a babysitter. Okay. But a lot of patients have given me feedback that this was a very good idea, and they like the check-ins, and they like that you can call my attention to something, or the team leads to something that they can get in or get addressed quickly. So that's really good. So let's talk. What is chronic care management? For someone who's watching is like, okay, how do I know I need that? So what is it? And how does that differ from traditional going to see your PCP type visits?
Well, traditionally, as a patient, you would go to see a doctor when you are sick, right? I don't know why people call it a healthcare, because with that model, I call it a sick care. You only go to see the doctor when you are sick. That's usually too late. We are in the age where we should care about preventative care. We should be preventing people from getting sick. And that's really the thought behind chronic care management. When you have multiple chronic conditions, it's super important that you stay on top of the condition and make sure that it doesn't worsen. A lot of chronic conditions don't have any telltale. They have no symptoms. You are not in pain, which makes it extremely difficult to know that your health is deteriorating. This is why the number one killer in the world is heart attack and stroke. There is no telltale. You might have a crazy blood pressure for no reason known to you and experience a heart attack or stroke, and you wouldn't know half an hour earlier that's what was coming, right? So chronic care management is really designed as a preventative health model where, in addition to going to see your doctor, and sometimes instead, we proactively reach out to the patient and we check on them. We ask them the questions a doctor usually asks. We look for the symptoms of the condition either being managed or is deteriorating, right? And the whole point is you don't want to get to the point when you are nearing a heart attack or stroke or kidney failure or, your diabetes gets out of hand. There are ways to prevent it. There are ways to, reverse it, improve it, but you really have to do that periodically. So chronic care management program covered by most insurance plans today are designed just for that. Empower the primary care doctor, who, by the way, never ever has the time to really see these patients with multiple chronic conditions as often as is really needed. This is the program that allows the primary care provider to keep an eye on the patients, ask the questions, proactively reach out, and track development. Because think about somebody living with a high blood pressure. Even if they come and see you every 3 months, as a doctor, you only have 4 blood pressure readings from them. Because let's face it, patients forget the diary. Patients forget to measure blood pressure, right? You as a primary care provider are flying blind. There is not much that you can do with a one reading. But think how powerful it is if you get daily readings, every other day readings. When you get a reading, when the patient wakes up at 6 o'clock in the morning, when the patient finishes exercise at 2 p.m., or before they go to bed, that's a whole different ballgame. You can start looking at trends. You can start looking at how medication wears off differently with each patient and adjust it, really personalize it to them, right? This is the point of chronic care management. Get more data, more checkpoints on the patient, start looking for trends, start reversing deteriorating health, start looking at the symptoms, and keep the patient healthy out of a hospital, out of emergency room, allowing them to, live the best possible life independently with a peace of mind.
Yes. And I have to say, your point on the blood pressure resonates. A lot of times patients come in, there's white coat hypertension, the blood pressure is high in the doctor's office. I tell them, hey, relax, I'm not going to start. I mean, in some cases, I do have to start medicine right away because it's really high. But a lot of times I tell them, patient, you don't live here. I want to know what your blood pressure is at home, your comfort zone, where you are most of the time. And let's make an informed decision or make a decision on blood pressure medicine based on that. So this is a very, very good avenue to do that. And I've seen people send their data through you to me. And so this is good. Now, my question is, can you give other examples of how this can benefit in between? I know we talked about blood pressure, but are there any other scenarios where this is a good idea for someone who's like, well, I don't have high blood pressure, I'm fine?
Well, chronic care management program is for those who have at least 2 chronic conditions, right? So you qualify for the program, or rather your insurance will pay for the program if you have at least 2 chronic conditions. So you do have a reason to be checked on. But the real benefit is, first of all, a deeper insight into the health, into their lifestyle, into their habits. We see mostly older patients enrolled in chronic care management. This is where you start having issues, you are getting older, perhaps your family doesn't live close by. This allows the patient to get care directly from the comfort and safety of the home. How many patients have an issue getting a ride and getting transport to and from a doctor or to hospital, right? So first of all, you have a dedicated person who, kind of keeps the whole health history in one place and checks on you and really looks for changes in your health patterns and data. Then this patient is this care provider, this care team is available to you 24/7. Dr. O, I know you work very hard, but you cannot be available to your patients 24/7. As part of chronic care management, the line is open 24/7. They can call outside the doctor's office hours. They can send a text message. If you are thinking you might have to go to emergency room or to urgent care, patients can give us a call and, triage with us. We might be able to get a hold of you instead of the patient going into emergency room. So, a huge benefit of us, triaging the patients, being available around the clock, and can also have an inside track to the doctors to flag, hey, there is a person who thinks they might need to go to emergency room. Is there a way you can maybe check on them? So that's, the few of the benefits that as a patient you get.
Awesome. So I have someone who's watching who's like, oh, I love the idea of this. Maybe they have a mom, an auntie, a grandparent. They're like, oh, this would be good. I would feel more at peace knowing that my loved one is under the care of a physician who has this program. So my mom is being checked on, or my grandma is being checked on. But they're wondering, well, my mom can't use her iPhone, or my mom can't use a computer. So can we talk a little bit about the technology that's involved with the chronic care management?
Yes, and this is one thing that really differentiates Lara Health. I've been, in the virtual care for over a decade. So I've seen, everybody trumping the fantastic technology and apps and Bluetooth devices and, AI. We always laugh because, that's wonderful for the techie 30-year-olds. It's a disastrous experience for somebody in their 80s, right? And so we really built a platform that is designed for older, non-techie generation. We do a lot of it through traditional phone calls and basic text messaging, because we know that's what really our client base, our patient base requires. Most older people want to talk to somebody. They don't want to talk to a chat box or type in an app. A lot of our patients will really have a hard time downloading an app. We have an app, but it's optional. So you can combine chronic care management with other programs often available, such as remote patient monitoring, remote therapeutic monitoring. If you have a patient who wants to track a blood pressure, we have blood pressure monitors that don't require internet, they don't require mobile phone, they don't require app, logins, accounts, none of it. It looks just like the old clunky blood pressure monitor that you probably already have at home, but it's really smart inside, and it sends the readings directly to us with the patient having zero setup. And so we really focus on catering to older population where we know they struggle, because it's really important that the patient finds it easy and stress-free to monitor their health, access the care team that looks after him, and not cause additional stress just because they forgot a password to an app.
I gotta say, I like it, and I've actually taught some of my older folks how to use their iPhones, their portals, and all that good stuff. And we test out televisits, so it's a good way also for them to get used to some of the technology that can help them feel better. If COVID, God forbid, when COVID happened, people had to get on platforms. They had to get care somehow, and so. But I like how you make it simple, easy for people to sign up for. So this is good. This is good.
Well, we do have an app, but what we tell these patients, because of course many of them get very nervous. Oh, do I have to use an app? Like, I don't know how it works. No, you don't have to. But maybe you want to give it to your daughter, your son, your sister, because today people don't live close by anymore. Families spread around the whole America. So we are not just giving a peace of mind to the older mom who is living independently alone. We are giving a peace of mind to the whole family, because others can download the app and they can track mom's progress. They can see if her blood pressure is okay, if she's logging diabetes, if she's logging medication, etc. So there is an app, but we made it optional.
Yes, and I have to say, one of the things I love too is when my patients come back and tell me that they enjoy having someone to talk to too. Additionally,
well, that's a huge thing, because I think really COVID highlighted the mental health crisis in America, and it really isolated all the people. We get that a lot, especially with older patients who are already slightly isolated, because often you are not so mobile, you have trouble moving, etc. Having somebody to listen to you, so you can just off burden all your worries, that alone is a huge benefit.
Awesome. This is good. I'm glad that you do that. Now, my next question to you is, let's talk challenges. I know we talked a little bit about the techie stuff, but what are some of the potential challenges that people may face when they plan to sign up for this, so they can anticipate when participating in chronic care management? What would you say?
Well, there are really not a lot of challenges. Obviously, your practice has to be sign up with a program, right? Okay. And you might be unfortunate that your primary care provider does not offer the program. That, I'll say, is probably the biggest challenge. If your doctor offers it and you qualify, really there is no barrier or challenge. Today, most insurance companies, most insurance plans cover the cost. They might be a copay or deductible applied, but the cost is so little that I really think it's worth every penny. I think Medicare copay is about $8 a month. To have somebody available back and call, preventing you to go to a hospital, to go to emergency room where you would obviously pay a fortune if you have to. If we can save you unnecessarily trip to a specialist or other facility, this is worth paying. And with secondaries, then everything is covered. So we don't really see lots of hurdles.
Okay, awesome. Now, can you share a little bit about success stories, like any story that comes to mind about things you were able to do, or testimonials from patients as to how this had been a life changer or game changer for them?
Well, we've helped a lot of patients avoid events like heart attacks and strokes. Something that is really funny, because patients says, "Oh, I thought that was just not happened to me." And that's what I mentioned is, with chronic conditions such as high blood pressure or, some heart arrhythmias, etc. It's incredible how patients are unaware of the, conditions they might have that just simply don't have any symptoms. You are unlikely to know that you have heart arrhythmia. Very few patients know. And you really have to know what you are looking for to detect it, right? So we screen for this. We provide coaching, lifestyle coaching. I mentioned at the beginning, you'll be surprised how small, tiny, but consistent changes to your lifestyle make a huge difference. We had patients who said, "Well, I don't need this. I have medication, I have high blood pressure, but I'm managing with the medication." We thought, "Wouldn't you want to get off the medication?" And they thought that it was not possible. And we walked, every program we have comes with 6 months of digital coaching, and it's both through a content that we share with the patient, as well through these monthly check-ins with the care team. And we had patients who were able to lower medication, improve mobility, outgrow some of these conditions. And they thought, "We thought that was never possible." Yes, it is. It is possible to actually get healthier. And they often say, "Well, but you are going to make me to eat salad and go on a diet, and I don't want to be hungry." Actually, you would be surprised how tiny and insignificant and actually pleasurable changes you can make to improve your hypertension, lose weight, become more mobile, whatever that might be. So yeah, we have we have a lots of success stories where patients were, "Wow, we are so surprised. We didn't think that, at my age, I feel 20 years younger, 6, 9, 12 months into the program."
Awesome. And I echo your sentiments on, you think that being healthy is like a punishment, or you get to give up. I mean, yes, you make changes, but it's not as arduous, it's not as hard, it's not as miserable as people make it seem. You can eat your way actually to better blood pressure. Enjoy your meals too. Okay,
Oh,
so I'm glad that
absolutely.
you do what you do. I've seen patients get off medicines. They're shocked. "Oh my God!" And I'm like, "Yep, you got to keep doing the lifestyle things, because that's your new medicine now." So I like that we get to partner in this to help empower our patients. And the truth is, when you have some hand holding, I can speak to it even in my life, like in areas of my life where I have someone keeping me accountable month by month, consciously, subconsciously. I know that I stay doing the right things because I have that encouragement. So you offer that to our patients. So this is good. Now let's talk family members. So family members, caregivers who are like, "Okay, my mom is doing this program. How can I support her? How can I encourage her?" Are there any tips for family members or caregivers on how to support your loved ones who are participating in chronic care management?
Encourage them. I mean, acknowledge that they are trying, their best to improve their life, that they are making small changes to lifestyle. Encourage them. It's fantastic where we see patients in their 70s, 80s, sometimes 90s, and they really create this wonderful buddy system with our care leads, and you see them all of a sudden working hard, and you see the results, and it's a completely different person 6 months later, and they go, "Wow, 6 months ago, I had this hurting me and this problem, and now I'm enjoying life, and I'm gardening, looking after my flowers, going again for a little walk with my husband or my daughter." And they're really enjoying life. So embark on the journey with them, and show them that you care.
Awesome. Awesome. This is good. This was good. So summary, I have someone who's watching who's like, I don't know. Or it's going to be more phone calls, more visits, more this and that. Any words of encouragement before we round up, for someone who's watching who could benefit from this program, but is unsure, a little, I don't know about it.
Well, give us a call. Every practice we work with, there is a sign up, a web page for the practices we work with. The practices have marketing materials. There's a dedicated number. Talk to our team. We can walk you how the process works. It's not extra phone calls. It's not extra work. It's very personalized to each patient's desires, conditions, circumstances. We work around the patient's desire. We work with the doctor to make sure that the patient truly benefits. So, my encouragement would be research if your provider offers it, such as Dr. O. I know Dr. O, I believe, has a sign-up page for Lara Health program on her website. And yet, talk to us and we can walk you through it.
Awesome. So, for those who are wondering, like, okay, yes, let me see, because not everyone who's watching is my patient. And by the way, please share this. If you're watching, I forgot to mention that sharing is caring. Really important. You can forward this to other people who in different states who could ask their own doctors to advocate for this kind of care, this level of care in their network. So, where can people find you to get more information about this, and maybe also introduce your caregivers to it?
Yeah, we have a webpage. Look us up. It's lara.health. No .com at the end. So LARA, Lara.
I like that. No .com. You made it short and sweet.
Yeah, we make it as short as possible. So lara.health. And you can contact us through the website. Talk to your provider, ask them if they offer a program like ours.
Awesome. This was very, very good. I know that a lot of people have gotten information from this on how they can empower their loved ones themselves in between doctor's visit. I know this was helpful, so please share with those who could benefit from this. Martina, I almost called you Lara.
Happens all the time.
Happens all the time. Thank you so much for coming and answering the questions. I appreciate you big time.
Thank you so much. Such a pleasure working with you, Dr. O, and your patients. I hear from our team, they're lovely. So thank you for letting us to help.
Oh, awesome. I'm glad you offer the services you do. So this was good. This is a good partnership. All right. Thank you all for watching. I do see comments here and hearts. Timothy Berna, thank you for joining. Isabella, I appreciate you all. As always, everyone, sharing is caring. Forward this, tag them, email, text, whatever else you need to do to empower those in your world. And as always, if you're looking for an awesome, a thorough, and a passionate family physician to help you live long and well, I am she. Have a good one, everyone. Thank you again, Martina. This was
Thank
good.
you so much. Bye-bye.